Welcome to BW Healthcare World. Today is World Stroke Day, and to have a discussion around strokes, I have with me Dr. Padma Srivastava, who is a consultant and the professor of neurology at the All India Institute of Medical Sciences. She has special interest in stroke and multiple sclerosis. She was conferred with Padma Shri for the year 2016 by the Government of India. She has over 200 publications and several projects on stroke, including that on acute treatment strategies, restorative therapies such as stem cell in stroke, cerebral stroke, epilepsy, among many others. So welcome, Dr. Padma, to BW Healthcare World. Since we're talking about the World Stroke Day, if we speak from the perspective of understanding the issue of strokes, what exactly happens when we call it a stroke? And also, I'd like to understand, are all strokes life-threatening?
Right, great questions. So the stroke or the brain attack, we call it an attack because it implies an emergency. So a stroke, as such, means that there is a blood supply issue to the brain. So you see, the thing is that the brain is not a storehouse, unlike a liver. You know, you have a storehouse for, there's glucose there, that's the reason you're able to fast, and you can still maintain. But unfortunately for the brain, every single nanosecond, you need a constant flow of blood which supplies glucose as well as oxygen. So if that blood supply is cut off by whatever, the cause, whether the blood vessel is blocked or the blood vessel ruptures. So when it is blocked, we call it an ischemic stroke. When the blood vessel ruptures, we call it a hemorrhagic stroke or a bleeding in the brain. So therefore, when there is a cutoff of blood supply, then the critical component of the energy which is required for the brain to function, which includes the glucose and oxygen in layman terms, is not available. And if it is not available within minutes, the area which is requiring that nutrition will die. Simple. So if I have to put a corollary, if somebody, is strangulating, 3 minutes, the guy loses consciousness because all the blood supply is actually coming through the neck to the brain, right? So therefore, and in the when you look at the blood supply in the brain, it's like a tree which branches into a fine network. Then there is a mesh. So you look at your own, little finger. Look at your little finger. That's the size of your internal carotid artery. They're here, okay? And half of this are what are called as vertebral arteries behind. Now these arteries branch, and if you put your palm onto your hemisphere, now this is what is called as a middle cerebral artery. The entire supply is like this. Then they branch into little networks, and each little branch is supplying a eloquent or a crucial area. Remember, the brain is the supercomputer, isn't it? Everything. Now you asked me a question, I am replying to you. There are reflex actions which I may be using my hands. I may be choosing the words which I need to communicate with you, the language, the emotions. Every single thing is dictated by the brain. So something wrong here, automatically the function which we take for granted is lost. So for stroke is a life-altering experience because all these reflex actions we assume a part of our living are suddenly, it is a suddenness which counts, that function is lost. So if it is a very small branch, it's a small function which is lost, it is a minor stroke. But if I have this big artery which is blocked, one hemisphere lost, that's life-threatening. So it is a spectrum. So it can be minor, it can be huge, and can be life-threatening and cause death. But what it actually causes is a sudden loss of a particular function. It could be minor, it could be major. That is stroke for you.
Right. And what are some of the possible causes that create this situation because of which stroke happens?
Yeah. So again, another great question, because obviously when you're looking at the stroke statistics, And I talk about India in particular. Now, I speak to you world over, that is. And if you take the developing world, prototype India, every 40 seconds there is a stroke. Every 4 minutes there is a stroke death. So as we are conversing, there are these strokes happening.
Right.
These are Indian Council of Medical Research statistics. So when you look at statistics, they're truly staggering. So when you look at the stroke burden in society, are we aware that all this is happening? No, we are not. And even when we converse, we think stroke is happening to someone else. Stroke can happen to us, to our loved ones. And we need to be aware, because we need to know what is causing it, what can we do when the stroke happens, and how to prevent. And obviously, there's a life after stroke. So how do you get the disability back in action? So what causes stroke? Now, there are factors which you have no control, and that is age. So yes, increasing age is a risk factor for stroke. So also is for heart attack. So also is for several other issues. Besides age, there are some genders, there are some racial factors, there are some genetic factors. And again, we don't choose our parents. So I'm not talking about factors where you have no control, but then there is a big group where we can be in control. It's in our hands. So in that, when I teach my students, I say the number one risk factor for stroke is hypertension. Number two risk factor, hypertension. Number three risk factor, hypertension. The reason is high blood pressure is so enormously significant in causation of stroke, whatever be the type of stroke, whether it is an ischemic stroke, it is a bleed, recurrence of a stroke. What happens when I treat a stroke? I try to take the clot out. Will there be a bleed in the brain? And also the outcome of a stroke, and also vascular dementia. Blood pressure is one unifying big risk factors. And that is one thing people really don't actually understand, because the moment you are diagnosed with hypertension, you're put on a medicine, the blood pressure normalizes, and you say, why should I take the drug? And you stop it, which is a very normal occurrence, which one should never do that, because BP is a silent killer. The number two would be diabetes, which is a no-brainer. Number three is any heart disease. Heart and brain are very, very closely correlated. What happens here is reflected in the heart and vice versa. Number four is obesity, physical inactivity, bad lipids, obviously, bad cholesterol, bad, triglycerides. But I think the most important risk factor is smoking, excessive alcohol. Okay. So, and these are lifestyle issues. So lack of physical activity. And what we're also seeing is that there are a lot of, things happening in young people, like you have young heart attacks now, you have young strokes happening in 30, 35, 40 years of age. Now, why is it that happening? So we have sort of a shift, I must say, in the occurrence of vascular risk factors, which includes diabetes, hypertension, all that. So you have young hypertensives, young diabetics. But I think beyond that, it's also the lifestyle again. So people, are living in more in a virtual world. There is loss of social connect. There are these, the sleep. The sleep is the most happily sort of, we sacrifice it, that many. And then most of us are becoming owls, because we are built as larks. And then you have a bad lifestyle in terms of developing central obesity and excessive kind of activity, which is hazardous. So sleep, hygiene, which is very, very important. I have a feeling all of these are also contributing to the youngsters getting prone to kind of, being predisposed to. I believe that a lot of them are preventable. They're within our hands. And if you modify them, you wake up. There are stroke risk cards available, which you can actually type out your risk factors. And when you reduce them and look at how the risk scores come down, which could be an impetus to do that. But yes, largely, this is where I can give you as a synopsis of what can cause a stroke.
And Dr. Padma, you brought out that a lot of young people, younger generation is facing a stroke, and especially when they're working out. Now, what I really wish to understand is these young people who are dying of cardiac problems or strokes while working out in a gym. So obviously they are taking care of their body. they are conscious about what they eat. I think the younger generation is little more conscious than we as a generation are. Then why so much increase in fatality in these conditions?
Yeah. So yeah, you're right. There are a lot of young people just dropping off dead, and I believe that excess of anything is bad. Excess of anything, and I think it has to be a balance in lot of situations. So if you have not slept through the night, and then you have a continuous schedule of meeting deadlines, and there is an internal kind of that stress, the hormones and the chemicals which are released because of stress, which make you actually work more, because you perform because you're in this high levels of whatever, you just that they always say in layman terms, your adrenaline, too much of that is going to be very, very hazardous. And then you factor in that in spite of the fact that I've slept at 3 o'clock in the morning and I have a schedule at 8 o'clock I'm on, I still have to put in my 45 minutes of gymming is really not required. You see, you need to understand the body has a way of telling you pain is one thing, which is a warning. Like, look, there is something amiss. We need to listen to the body. And I think balance is the most important thing, whether it is work, whether it is physical activity. I will never say that one should be a couch potato or you shouldn't be physically active, because both mental and physical activities are a must to be able to prevent not just brain and heart attacks, also to prevent memory loss and dementias. Most of us are very worried about that as well. But I think overdoing something and not doing it the right way, you're looking at a television screen and trying to do your physical activity, or all those asanas, which may not be the right way to do it. So I think doing the right way and maintaining a balance is much more important than saying that, oh, I also do it and I need to do definitely this much, and the more I do it, the better it is. I don't think that's the way it works. I don't have all the answers, but I do believe this, and I'm concerned that there are these very young people who are, we're losing them with no real risk factors that are in your face. But so I do think that it is probably a disbalance of doing things and overdoing some things, which should not be done.
Got it. And Dr. Padma, you mentioned genetics as one of the causes that could be related to strokes. Now, for a layman, the moment we use the word genetic, it is taken as hereditary, right? Now, what should be the concern of a person whose parents have had stroke in their lifetime?
A brilliant question. So again, when you talk about stroke genetics, we are not talking about mother had a stroke, father had a stroke. The common garden variety would be just that. When you look at hypertension, the number of hypertension people in this country is probably more than 1/3 in the adult population. So it is really prevalent. We also have a lot of diabetics, and we know that, given the statistics, we are at a very, very high prevalence of diabetes. Said that, so when there is a stroke or a heart attack, or you even have this hypertension, diabetes in family, one needs to be cognizant of the fact, and I always advocate that once you cross 30 years, please get your blood pressure checked, get your blood sugar checked, that in case a blood pressure is found high, change your lifestyle, go to the doctor. If you're prescribed a medicine, don't leave the medicine yourself. Take the consult and then do accordingly. So you need to be not wait for an event to happen. You can preempt any problem from happening and avoid it. That's one. But the second important, and those are multifactorial things. So they are not by one gene, they're polygenic. But there are certain stroke genetic syndromes, which are single gene disorders. Like this is not for lay public. There's no need to remember all this, but there's several of them. We have CADASIL. There are a whole lot of, single gene disorders, and you have available gene studies, like we do whole exome sequencing. We do a lot of these, genetic studies. We hit upon the gene which is concerned, which is, if it is there, that do run in families in a different way. Like they have autosomal dominant inheritance, there's an autosomal recessive inheritance, there could be other varieties of inheritance. So accordingly, we sometimes screen people. Okay. But remember, another thing is all genetic syndromes, we don't go about screening everybody, because it is important to control some risk factors like BP and blood sugar and etc., especially lipids. There are a whole lot of genetic syndromes where the lipids go haywire. However, if there is a genetic disease in which there is no cure, then I'm not diagnosing this in a young person who is not got it. Then I'm ruining his life now. You know, he may develop it after 30 years, but saying that, oh, I'm going to develop that, is not going to play around with. So we actually put, as I'm a clinician for last more than now 35 years, we always put patient first as an individual. He's unique. So these are our guidelines. I know these stroke genetics, and there are a lot of studies from India now. We have mapped out the stroke genetics in South India, in the northern part of India. There is a geographic predilection. We've done a lot of studies, and I know what are those, stroke genetics, which are also unique to this part of the world. In fact, there's a whole lot of studies all over the world which are there. And we are getting this bunch of genes which may be predisposing. And I know that there's been breakthrough in gene therapies in other disorders. Maybe we will find something for stroke as well. But at this point of time, it's important to understand that if there is a problem of a particular thing like hypertension, diabetes, dyslipidemia, or stroke, or heart attacks in family, be cognizant, get yourself also tested even when you are young. Don't wait till you are 60 or 70, have a problem, and then start doing it.
So since you're talking of diagnostics, Dr. Padma, is there a way to predict the possible strokes using some technology that has come in now?
Yeah, the technology.
Can you share a little bit about that?
Oh, yes. Actually, I would believe that the tectonic shift we've had in managing strokes is also because of this, Amazonian advances in neuroimaging, whether it is CT-based or MR-based, or even the Doppler ultrasound-based. We know whether it is a stroke or what type of stroke, which vessel is blocked. What do I do with the block? Can I unblock it? What will happen if I unblock? What is the chance of a stroke recurrence? What we call as a subtyping of the stroke. And also, if there are mini strokes or people who've had other risk factors, if somebody's come with a heart attack, I can screen the blood supply to the brain, and I would deduce if there is a predisposition to having a stroke next, and I can prevent that. So those are available, and routinely in our stroke chain of survival, we do what is called as a parenchymal image, and we do vessel image, all pari passu with the, the current state of art. And fortunately, this is available in most dedicated stroke centers even across India. That I'm very, very happy to say that. So I think the message should be like, look, if there is a stroke in the family, come and tell us. And if there is a stroke happening, come in time, because stroke management is so time sensitive.
And Dr. Padma, I've seen a lot of old people, they sometimes become disoriented. They start murmuring things, they don't remember stuff. And we don't know whether it is because of age, it is Alzheimer's coming in, or what is it. And also I've seen that, people talk about the electrolyte imbalance happening. How does one differentiate between an electrolyte imbalance or imbalance of salts and a stroke or chances of getting a stroke?
Right. So these are actually different things. So, and it can happen even to young people, but classically, when you're talking about an elderly person, and the elderly person suddenly becomes different in behavior or senses, then it does indicate that there is an alteration either in metabolism, or there could be a stroke as well. Those are we call as non-eloquent areas. You see, classically, strokes are producing sudden paralysis. He suddenly stops speaking. There's a facial droop. There's a loss of vision. That's one. But then there are certain areas of the brain when there is a stroke, you become confused, you become disoriented, you become, behavior changes. So yes, that is one. But remember, the stroke is very sudden, whereas all these metabolic things like low sodium, low sugar, high urea, renal function things, these things, or even any infection of any kind, in an elderly person can cause a big clouded state. We call it a big clouded dementia or a disorientation, confusion. So it could still be there. So we actually routinely do all these things. So it may have happened at 8 o'clock in the morning, but the family only realized it at 8 in the evening. Then you don't know. It may have still be a low sodium and low sugar. In fact, a lot of them are called as stroke mimics. So a low sugar can look at it like a stroke. A low sodium can look like a stroke. So we call them, we have a list of stroke mimics. We have a list of stroke chameleons, which don't look like a stroke and are strokes. And of course, the routine strokes. But that's a good question. They definitely, what the person need to do is, if something is like that, don't take things into your own hands. Please get into a medical facility for that.
Got it. And Dr. Padma, not all lives remain the same post-stroke. What do you think should the caregivers or the family members need to do to help and support these patients?
So there's a life, that's what I was talking about as a life after stroke. There is a life after stroke. So if you have a minor stroke, the life after stroke would be mostly geared towards not having a stroke again, or a stroke prevention plan, which is absolutely mandatory. So, once people won't know what a stroke is, but once a stroke happens, at least they should be geared up to the fact that, look, you shouldn't have another one. So that could involve compliance to the medication, compliance to the changes in, because I know people who are, they smoke like a chimney, they come with a problem. When the problem is small, they're okay, they go back to smoking. So you see, those things, those kinds of idiocy shouldn't happen. But in a major stroke, which leaves a disability, some may be bedridden, some may be left with a deficit. Depending upon the quantum of disability, they may require caregiving. And if the disability is very major, it's a huge stress to the caregiver, especially in families who don't have a good economic background. Then it becomes, a huge social concern, because the caregiver will have to then leave his or her job, look after, or try to get another person to take care, would again involve economics. So this becomes a hugely disparate situations, which could be very tragic. So in that, a lot of government institutes are coming out with a lot of programs. But I do think that societal support, family support is humongously important in it, to understand how to take care. And then it is, again, a spectrum. It's an individualistic, and it is a family-based system. And India, we have more family-based care rather than an institutionalized care, which is there. And for good measure, that's also nice, because we generally see families getting together, bartering the work, taking turns, so that you can minimize the cost concern, at the same time take care of the stroke victim, who is sometimes the life can be worse than death, because when you are dependent on everything on somebody, and sometimes they also understand that they're becoming a burden. It can lead to a lot of mental health issues, both sides, both the caregiver as well as the patient. Those situations, we do have groups who would come out and help. And even as a medical personnel, we also reach out and we try to help out in ways more than one. But it is not an easy situation to be in. That's why prevention is definitely, it's a cliche, but yes, prevention is better than cure.
So are there any side effects of the long-term usage of the stroke-related medications?
No, not really. In fact, like supposing there is an ischemic stroke and you have a blood thinner. So a lot of concerns come out of blood thinners. Why should I be using a blood thinner for long? Or if I'm using blood thinner, I'm having acidity, I sometimes have a bleeding. Yes, if there are those concerns, then we deal with it. But one message is, don't stop medicines on your own. If you have problems on that, come back to the doctor. We may have to change or do something. Remember, stroke prophylaxis is lifelong. Remember that. So it's not that, I'm feeling okay now, why should I leave the medicines, and don't leave them. One should not do that.
And Dr. Padma, what are the first aid that everyone should be aware of to handle any occurrence of stroke, and at least until the medical help arrives?
Unlike, say, heart attack, where they say, okay, give a tablet of, aspirin. For a brain attack, you don't do that. So remember, for a brain attack, time is essence, because every minute counts. So for a blocked artery, we give a drug intravenously, which we can give within 4.5 hours of onset. And if there is a large vessel, we can take it out by endovascular or mechanical thrombectomy technique, sometimes even up to 24 hours in selected patients. So therefore, the moment you recognize it is a stroke, go to the emergency of a stroke-ready center. That should be the thing. Don't try and do any heroics at home.
And what is your message on the World Stroke Day?
So the current theme, this year's theme is Together We Are Greater Than Stroke. Every year there is a World Stroke Organization's theme, and this year it is Together We Are Greater Than Stroke. Essentially, what it means is we can, somebody did say that, I think another statesman said this, yes, we can. So we should make right now our country, our situation stroke ready. We should be able to deal with it and ultimately make it stroke free. We can do it. Be aware what stroke is, reach out in time as an emergency, prevent it from happening.
Dr. Padma, thank you so much for taking our time, because what I hear is that if you're saying that the cause of stroke is hypertension, diabetes, heart diseases, because we are the epicenter of diabetes in the world, I think we as a nation should be very, very concerned about stroke. And like you said, we need to be stroke ready. And one message to take away from this conversation for everyone is that do not sacrifice on the basics of lifestyle. Do not sacrifice your sleep. Do not get onto smoking or continuous use of alcohol. Take care of yourself, because stroke is something which is preventable. With that, I'd like to end this conversation. Thank you so much, Dr. Padma, for taking our time.
Thank you. Thank you.